Do you ever feel like life is on low volume or the TV is never loud enough? I'm with you. Hearing loss affects 1 in 3 people ages 65 to 74 and 1 in 2 after 75. So what can you do when things start to sound a bit fuzzy? Here's what you need to know your body. Age-related hearing loss, called presbycusis, happens gradually due to wear and tear of the inner ear and auditory nerve. This can be worsened by excess wax and noise damage, which permanently kill the sensory hair cells in your cochlea that allow your brain to process sound. Certain medications are also toxic to the sensory cells, like those used to treat cancer and heart disease. Other causes of hearing loss include genetics and health conditions like diabetes and high blood pressure. Tinnitus, or ringing in your ear, can sometimes be the first sign of hearing loss. You should see your doctor if you find it hard to follow conversations when 2 or more people are talking, have trouble hearing over the telephone, or often ask people to repeat themselves. What did you say? We're here with audiologist Dr. Taylor. We know that wax can cause hearing loss, but what's the best way to remove it safely?
That is such a good question. So I don't know if you know, but I am Dr. Earwax online. So I get hundreds of earwax related questions. We actually videotape wax removals and post them on Instagram and TikTok. It's sort of like the Dr. Pimple Popper of audiology. I do not recommend putting a Q-tip in your ear. If you are someone who generates earwax, a Q-tip is just going to push it in further. In my opinion, the safest way to manage a wax impaction would be wax softening drops. If you suspect you have a wax impaction and that you just simply can't get out by yourself, I do recommend going straight to an audiologist or an ear, nose, and throat physician for a professional cleaning.
Okay, now that we have that settled, can you explain how hearing loss is diagnosed?
I recommend baseline hearing testing for all adults after the age of 40. When a patient comes in for a hearing test, the first thing we start with is a very detailed case history. Next, we take a look in your ears with something called an otoscope. And then we go into the sound treated booth where we do a series of testing. And that's a really good opportunity to then make sure you understand it and ask all of your questions.
So is there anything people can do to prevent hearing loss due to aging?
So hearing loss due to aging, that is not preventable. A big type of hearing loss that is preventable, though, is noise-induced hearing loss. So I wear something that is custom for my ears, and these are specifically designed for concerts. So they have a filter in it that lets all of the frequencies pass through just at a softer volume to keep you safe.
Cool. So what is your best advice to someone struggling with hearing loss?
Once we find that a patient does have hearing loss, the probably number one management option in the office would be hearing aids. They are so modern and techy now. This is not what you're picturing like your great-grandmother used to wear.
What can their loved ones do to help?
That's a really good question, and it's a really important question, how to communicate properly with someone with a hearing loss. The first thing to know is you should be speaking clearer, not louder. Enunciate better, get their attention first, and then have a conversation. Also, make sure you are turning down any of the surrounding distractions in the room. Be as gentle and supportive as possible.
That is such great advice. Thanks, Dr. Taylor. Although age-related hearing loss can't be reversed, management options can help. If you're concerned, see your doctor, because hearing problems that are ignored can get worse. Now you have the tools to know your body.